afternoon, everyone. My name is Yeong Bae, and I am a social worker at Fox Chase Cancer Center. Just to tell you a little bit about my professional journey that brings me today, let me just say that this panel that preceded me, you stole my thunder. You guys spoke to everything that I was going to allude to here in my slides, but thank you for the opportunity. So prior to coming to Fox Chase, I'd spent over a decade in hospice leadership, and I met many members of your community who came to hospice at the end of their journey. And I found myself thinking about, I wonder what people go through at the beginning of their cancer journey. And I thought about some of the way that hospice started in Great Britain, St. Christopher's Hospice. And what it was at its inception was, it was a community. People, yes, they received diagnoses of cancer, but it was important for St. Christopher's to create a community, a place where people came actually to do physical therapy and to find community and to find ways to enhance the quality of their life as they lived with cancer. And so after a long career in hospice, I thought I'd like to do some direct clinical work. So I found myself at Fox Chase Cancer Center, and I'm embedded with the supportive oncology and palliative care team. I'm also a psychotherapist in a group practice where I do meet with adults who live with challenging health conditions. So it's from my reflections over the past year, my work with people who live with disease, that I bring some of my thoughts about how we might manage the inevitable up and downs, the emotional up and downs over as we journey. And as the panelists spoke to the issue, we're all at different points in this journey. Some of us may have received our diagnoses in the past few months, and others are well years into survivorship. And as we all heard, the challenges, there are a lot of commonalities. There are ups and downs along the journey. Some of the familiar emotional companions that we met early in our career, maybe they reappear to us in different form, but nonetheless, I think I heard that over the course of the journey, you are inevitably confronted with the challenge of dealing with difficult emotions, but also a lot of joys and unexpected surprises. So the first thing that I would say about So in palliative care, I sit in clinic, I sit at the bedside at the hospital every day, and people talk about acute pain. They talk about the difficulty of having a good day when out of the blue you have this sharp, searing pain, or the difficulty of having a good day when you're trying to breathe and it's so hard. And so people talk often about these peaks, many peaks that you experience in the course of a day, maybe over the course of a week. And so what I often hear the physicians at Fox Chase talk about is, how can we help you to flatten some of these peaks so that we can achieve a baseline, an ongoing experience of a good week that we could live with? And everybody defines that good day or good week in their own personal ways. Some people can tolerate the 8 out of 10 pain, just want it a little bit lower from a 9.5 to an 8. And many people say 5 out of 10, I could live with that. And very few people say that their expectation is that pain would be eradicated, because many times that's not possible. And then when we think about the cancer journey, as we heard the panelists speak to it, the shock of initially hearing that you have this thing called cancer, and all of the emotions that evokes in not only you as the patient, but in your family members and caregivers, think about the extreme, the intensity, the shock of it all, its lasting effect, and then take yourself back to your first medical oncology visit. Take yourself back to the first scan after 6 cycles of chemotherapy. So many stopping points along the journey where you might possibly have a peak. And so we're talking about maybe one of the strategies is to find a way to dose, right? Dose this thing called emotion. So I sometimes use the example of how many of you guys are on high blood pressure meds? Just for maintenance. Some of us, okay, myself included. So doctor says, Yeong, here's 30 pills for the month. I want you to take this, and this will help manage your blood pressure. And I use the example of us, how many of us would take those instructions and say, well, yeah, I'm gonna take all 30 pills on the first of every month, okay? Or how many of us would say, every Sunday night, I'm gonna take 7 for the week and I should be good, right? So we're talking about dosing a little bit every day, 1 pill a day, keeps my blood pressure in the 120 to 80 range. That's the desired. But ask yourself, do we take that same kind of wise approach when it comes to our emotions? Okay, I'm talking about dosing. So just to get to the objectives here, we're going to look at some of the emotional impact of, let me get it to the right slide. Looking at the emotional impact of cancer, the different experiences that we have at different points along the journey, and as we heard just prior to this session, the importance of a support group, and to be intentional about who is part of your supporting cast that will help you through these next weeks and months and years to come. And then what are some strategies that we might employ to take care of ourselves? And we're talking about, we put so much money and research into caring for our bodies and managing this cancer. And I want us to think about how do we invest the best part of ourselves, right? Our energies, our emotions into caring for ourselves, and hopefully building up some resilience along the way. So what would that look like, resilience? All right. So, the most common emotions that we encounter in cancer care are anxiety, depression, shock, anger, guilt. And I'm sure you can think of many others that you can add to this list. So it's very much an assault when you really think about it. Okay, there's the shock of how much of that comes into your mind and in your emotional center when you hear that news. But have you ever wondered how much of that is constantly assaulting us every single day, and are we aware of the chronic or the long-term effects of living with that high level of stress, day over day, week over week, month over month? So there's a lot of studies. I'm sure you've read the headlines, like the malady that afflicts modern life is not disease, it's not heart failure, it's not cancer, or it's not COPD. What doctors all over the world are wondering, are some of these things bubbling up to the surface because we choose to live with so much stress, right? And when you're caring for a loved one in cancer care, it's a lot of stress on you. So I think I want to take this moment to say, this is not only for those of us who live with cancer, but it's also for those of you who identify as the family member, the most important caregiver, without whom cancer care just can't happen. And maybe there are some members of the meso community that you can think of, maybe veterans, some older members of the meso community who came to the hospital to learn that they have cancer, but they have outlived all of their family and all of their friends. And I can't tell you how many times people talk in the midst of cancer care about how lonely it is. They can deal with the cancer, they can deal with the appointments, but the loneliness of it all is what they want to talk about. So there are significant emotional challenges, and as we have already addressed here, there are so many things that can trigger these strong, intense revisiting of emotions, whether it's in those days right leading up to a scan, okay? And you know, I bet you all of us have done it. We go into our health record, we see some of the labs, some of us might have even piped it through ChatGPT to see what it means, right? Because in this day and age, the pathology report comes before the doctor can even pick up the phone to call you. And no doctor is sitting around waiting to see when it's signed by the pathology director so they can catch it before you read it. So I think there is a lot of wisdom to, again, dosing information in a way that is healthy, in a controlled fashion, because we can take bad news a little bit at a time. And that's different than being walloped all at once. And then, you know, I'm a big proponent of I wouldn't say they're therapeutic modalities. They've been around for thousands of years. And we've spoken about it, this thing called mindfulness, okay? A way that we've kind of packaged cognitive behavioral therapy in something called acceptance and commitment therapy, okay? So mindfulness, I want to just talk about that a little bit. I don't know how many of you formally could say that you have a mindfulness practice, but I bet you all of us practice mindfulness in one form or another. And if I can encourage everyone to deepen their knowledge of this philosophy, if you can actually build it into your day-to-day living, I think it helps all of us, the entire community, the patient, as well as the caregiver. And it really comes down to this, like noticing, okay? Noticing. When you find yourself checking that EMR, reading your medical record for the 4th time by 12 noon, I want you to just notice that. Okay, and if you're the caregiver, I want you to just take a moment to notice that, all right? And you might even say, you know, I notice you've logged in 4 times. I can see when the last login timestamp was, and just be curious about it. It's not a judgment about how often you're in the medical record. It's just noticing. And if you do it in a supportive way, it begins a conversation that takes on a curiosity, an inquisitiveness. There's an invitational tone to this conversation. And, you know, I notice in the few days before the scan that I'm really avoidant. Or I'm noticing this week that I'm just really short with people around me. And I notice these, and most of us lean towards kind of negative observations, like, you know, you notice the things that you feel guilty about, that you want to judge yourself about. So we have this tendency for a lot of negative self-talk, okay? And it could be like, oh, I know the scan is not going to be positive, you know? I know the doctor is not going to give me a full explanation. I see it, but he rarely gives me more than a couple minutes. But notice what it is that we're thinking. Notice how we feel, all right? And then, like, you might even be able to notice where in your body you just notice a tension, okay? So we have our thinking selves, right? And we have our feeling selves. And then we have our bodies, and I believe that they're all connected, right? They're all connected. So what you think has an impact on the way you feel, and what you think actually has an impact on some body sensations. And it goes in all those directions. So if it's true that there is this mind-body connection, I think we would be wise to really learn this ancient skill of just noticing, listening, seeing. Maybe we find out that something that's always been there, we see it afresh because we have this posture or this attitude called mindfulness. All right. So coping strategies, coping ideas. Nothing earth-shattering, but these are really acts of kindness. A lot of them come from ancient practice, okay? So let me start with the most fundamental one, permission. Permission. So let me speak to the family members, the caregivers here. Nobody said that the best way to eradicate cancer is if you're at the bedside 24/7 and all you do is support for your loved one. That's the road to burnout. That may be the road to resentment. That may be the road to complicated grieving. So for the caregivers here, to give yourself permission, let me speak to some more difficult emotions. There is not a caregiver in this room who has not felt funny things like anger, maybe a little bit of resentment, wishful that things were different. That's part of your human experience. It's really necessary that we acknowledge that part of us. And this is where the mindfulness piece comes in, that we notice that we're feeling this way. Who can I talk to about this? Maybe you don't talk to your loved one, but maybe who would you talk to about it when you notice that this is changing? Maybe it's growing, or you had it initially at the time of diagnosis. That was your first thought. It's like, oh my gosh, what are we losing? And you know, this phenomenon of the lost retirement is something that I talk about every week in my practice. People who work 2, 3, 4 decades towards this planned retirement. There's a financial component to it. There's a social component. Where are you going to go and what you're going to do? And that's all shattered. It's nobody's fault. But reality is that kind of event will evoke a strong reaction in all of us. And I find people who will not acknowledge the impact on their lives in an honest way, they run into problems later on. Okay, so as a caregiver, it's really important that you get care for yourself, right? And that you give permission for yourself to be cared for. So what does that look like? Sometimes that has to be respite. That might mean for some of us to have a therapist so we can talk about the challenges of caregiving, okay? Sometimes we may not be the best patients. We may not be the kindest patients sometimes, and that's real. And so dealing with that, it has its challenges as a caregiver. And of course, for the patients here, you know, I think it's really important to be honest and face the strong emotions that get evoked in us when we find out we do have cancer. Sometimes we think about it so much, or we're wired in such a way that we identify ourselves as the person with cancer, right? You can live with cancer. I think as Cristobal said, you can live with cancer. You could be a person that has this medical condition with cancer. It's different when you say, I'm a cancer patient. You see how that's different? And then You know, if you find yourself so identifying the cancer with who you are, and that's an easy thing to let happen, I think it's a time to talk about it, you know, because we are not the cancer. We are not defined by the cancer. And for that matter, as the panelists spoke to it so eloquently, we're not even our cancer treatments. Cancer treatment is hard, but how can we live to what we value? And maybe it requires us to rethink what is most important to us, or we pull up the timeline, or we reconfigure it, because all of us have limited resources. But you know, if you find that you're fused with the identity of cancer patient, that being at the core, then you know, you have some work ahead of you. And that's where I think for every cancer, hopefully every cancer center in this country, social workers, hopefully the cancer provider you're attached to has an oncology psychiatry practice. There are these new folks called health psychologists that help us deal with these very troubling ways of thinking. And you can say it's unique to living with cancer. But I think it's really important that we spot within ourselves if we're over-identifying with the cancer, because that's not all that we are, right? All right, so let's talk about expression. So not everybody here in this room is going to want to sit in a room and talk about how they're feeling, right? We're not all wired that way. Some of us might be, and maybe as a psychotherapist, I'd like to think that more of us should be. But the reality is, the way that we were raised and the context in which we live, we're all unique. But I'll say this, we all have a need to express what we deeply think and feel as we're in the midst of this cancer journey. So what is it that you feel? What is it that you think over and over? And you might even experience bodily sensations over and over. And I invite you to be curious about what that means. You know, there's no magic formula for putting it all together and coming up with an answer, but the point of it is to be curious about it and engage in some sort of an investigational process and engage in some way to express what we feel or think. So everything from dance to art to the spoken word to the word that's sung, and for those of us who are so inclined to find spiritual expression for what our experience is. But we have all this wealth of resources, whether it's language, culture, family traditions, friends, support groups, and I think it's so important to start to draw on these assets to help us find a way to find expression to what we are experiencing. You know, sometimes in therapy, what I do is like, I'll say, you know, here's a list of 200 emotions. I want you to pick 2 or 3 of them out of this list, what you're feeling right now. And I'll get them, secondly, to say, tell me in your words what that emotion is, okay? And then I want you to draw that emotion, okay? Draw that emotion. And then I want you to give me an associated task related to that emotion. So I'm trying to get them to like look at this from different directions, from unexpected places, to begin to go a little bit deeper into what they identify as an emotion. But that could also be an experience or an incident. You know, think about, you know, some of us have had we've been in auto accidents, and it kind of like sticks in our minds for a few days, doesn't it? And For others, it may be with us for weeks, and we think about it, we relive it, and it can be helpful to kind of revisit it in a safe context, to kind of look at how we're feeling in our body about that, what our thoughts are about it, and find ways to move it forward, I think, by drawing it or dancing it or singing it or finding some humor in it, but to kind of unjar it from our minds where it has the potential to kind of be a rumination. So, and last but not least, a couple pleasurable things, okay? So I'm gonna go back to this notion of dosing. All right, so when we live with cancer, when we're caregiving, we're taking care of somebody who needs a lot of care, the kind of things that we used to do need to be redefined, right? Maybe we can't take that 10-day vacation to Asia, but what can we do in the way of vacationing that's reasonable and safe in the here and now? So when you think about the things that you can do on a day-to-day basis, what are those little life's pleasures? It's important to have a list of those so that if we're dealing with heavy feelings, you begin to shift yourself away from that by allowing yourself, giving yourself permission to enjoy a good dinner out. Maybe it's been a few weeks since you went out with a friend, or to enjoy a really good movie, or to spend time with friends. You know, I'll say to patients, you know, what keeps you from having friends come over? Because I hear you saying, you know, I miss my friends, they're really important to me, they help me through so much, but something about having them come over is a barrier, and maybe that is for you. I think it has something to do with not wanting others to see you in a different light, maybe not the able person that you want to be, but that ability to, that invitational posture is so important to our ongoing wellness, because you gotta fight this tendency towards isolation, right? You can, if you listen to all the negative talk, there's a chance you kind of end up alone, and that's not helpful in this journey. You need the entire team around you. So find the little pleasurable things in life that help us get through the day for the week. And they're accommodated kind of pleasures, because we may not have the reserve that we had. So let me use an analogy I use a lot in therapy. So all of us have a gas tank, okay? We have a gas tank. Let's say it's a 10-liter gas tank. When we spend a lot of our energies worrying about things in the past and what might happen tomorrow, when we find that our sadness is pretty deep and it takes a lot of effort to get out of bed, takes a lot of effort to do the things that we would normally do, we're spending part of our 10-liter gas tank just in our minds. Let's say you're using up 2 or 3 gallons of your gas tank just for those things. And the effect of giving yourself permission to enjoy little life's pleasures, okay, the little things, is you may find that over time you're only using 1 gallon of that 10-liter gas tank for this, a lot of this subconscious emotional labor over which there's no impact on the status of your cancer. But that's just human nature, right? So if you can find effective ways to spend less of your energy worrying about the past or future, worrying about things that you don't have control over today, or for that matter, next week, you're going to help yourself, because if you have more left in the tank, then you have reserve left over to do the things that are meaningful to you, that are important to you. And so, I think everybody in this room has had to kind of like reevaluate what are they living for, right? What is important to us? And maybe we've had to change our timeline. So we do that with like big things, but I think there's something helpful about like having an idea of what a good day is. Once in a while, I'll need to visit patients at the bedside and ask them, and they're living with very advanced disease. And I'll ask them to tell me what a good day is. And I remember one 80-year-old gentleman said, I want to go home and I want to be able to get out of my bed, make my own breakfast, bacon and eggs, and I want to walk my granddaughter to the corner so I can see her get on the school bus. And every Saturday, I want to update the sports card collection that my grandson loves so much. That's his good day. And I said, okay, so now that we have that goal, we're going to help you to get out of the hospital, and all of your limited energy and all of these efforts to support your comfort and dignity is going to be kind of geared towards those things. So for you, and for everybody in this ballroom, you got here. So you're not at the same place where my patient was in the cancer hospital. So your goals will be different. So what are your goals for this week coming up? What makes it a good day? And when it's a harder day, what will you draw upon to find balance so that through the little pleasures of life, giving yourself permission to feel and talk about the things that maybe you've kept hidden in your own heart, what will you do to find that balance? Okay, and these are the little day-to-day things that we can do to help ourselves and our family members. All right, so support systems, and I'm almost done here, and I'll take some questions. So, ROA family and friends, please, this is the time to draw in your resources. I hope that every single person in this room can think of close family members, distant relatives, friends that you can call on. It's so hard to ask for help, let's be honest, right? Many of us have had successful careers. We've been very able. We've been the caregivers for our family, and it's so hard to admit that we need help. But this thing called cancer care cannot be done all by yourself. And you have to come to that really hard realization. It cannot be done alone, all right? And then, as you yourself know by experience, and I'm so glad I came here, and I'm kicking myself that I didn't come for the whole day, but I got, just sitting there for 45 minutes before this presentation, I got such a sense of the community. And it's not like you all are from the same town, but there is such a sense of community and so much sharing of information and wisdom and advice that I gotta think that every single person who participates in these support groups gains from it. Everything from who's the doctor to call on the call upon in California to where do I go if I'm in New York State. Lots of intelligence and wisdom there. And I do say, being an oncology social worker, if you don't know who your oncology social worker is, ask your doctor, because I think it's always a necessity to have psychosocial support through this thing called the cancer journey. And it's not that the social worker always does the direct counseling, but they can be a good referral source for, we work with these health psychologists in our town, and they're really good. We trust them. Here are some other support groups. It's really hard to find in-person support groups, but but hopefully your cancer center can give you those resources, and I think it's important to say that the malady of loneliness creeps upon you. You don't even know it, and you can feel that as a caregiver. You could feel that as a patient. Don't let that happen to you. Demand support. I think, I forget who said it, but it's so important to take an active role in your own care, that nobody will care for your health care as much as you, and you are entitled to the best care. You're entitled to the best resources in your health plan and in the place where you call home. And I think it's these strong support networks that help make possible the stories that you heard today. You would go from initial diagnoses to treatment to survivorship, and the many challenges that continue even after you hear those fantastic words, no evidence of disease. So on that note, I will end my presentation, and I'll take some questions from the audience with the time that we have left.
Thank you.
Yeah. We have them back. We have a gentleman in the back of the room there.
Thank you, Julie. Thank you so much for your presentation. Just for myself, I want to say that, we've learned so much in these last 2 days, and equally as important as everything that I've heard today, your presentation on emotional balance is just as important and weighs up there with everything else that I've learned and experience in my own journey. So I just want to say that you've touched on so many things. At the end of your presentation, you shared about, when we're not in this by ourselves. I used to live in the world of I, and today I live in the world of we. And you mentioned that, repeatedly, that, we're here together. And to me, that was a learning experience, because I grew up, in my own childhood that, Herb, you do this and you take your own action. But I didn't have all the answers, and today I still don't have all the answers. And I know today that I don't know what I don't know until I find out about it. And so I have to open up my ears and listen to learn, and learn to listen. So my perspective about things has completely changed. Having this dis-ease, which is the disease that I have of mesothelioma, not only has allowed me to understand the things that you talk about in emotional balance, which is, the isolation, being in a negative space, getting out of there, and also, the idea of acceptance, which has been pivotal for me. I don't have to like the fact that I have this disease, but the fact that I accept it and that I can move forward with it is so pivotal, in helping me to move forward in this journey and understand that I'm not doing it alone. I'm doing it with the help of others, and I keep an open mind. And all the things that you talk about in emotional balance is going to keep me on that journey in a positive way. So it was just a comment, not a question. Thanks.
All right, thank you. Over there. Making you get your steps in.
My question for you is specific to people that maybe have a diagnosis and around supports for their children or their grandchildren. When Carla was diagnosed, our oldest child was 22 and our youngest child was 10, and they were in very different places in their lives. So just think about the importance of the whole family, and if there's things specific to kids that you think are most essential.
Sure. That's an important question. Yeah, you know, when we have cancer in the family and there are kids involved, thankfully there are wonderful organizations and lots of support specific to helping kids cope with this terrible news. And the kind of things that I've gravitated towards is the truth. Truth is really important. I come from a society where it's actually taught to us not to talk about that, especially the really older folks and the really young folks in the family. Yeah, I think in an age-appropriate way to explain that mom or dad is sick, but getting excellent care. This will not change your ability to keep with soccer or baseball. So this is where I think having support to maintain the rhythm of a regular family life is important, because we can say that we're dealing with mommy is sick, but mommy is getting really great care. And I'm going to be at the hospital for 3 days, but dad's going to take you to practice. I know I usually do that, but I'll do that when I'm back. And also, you know, Uncle Joe is going to help out. So I think you try to normalize the schedule and the impact on their lives, because it's very scary. And then the other thing, you know, you give kids, teenagers, permission to say what they're thinking, right? Earlier I was talking about, like, we think these things, we feel these things, and it's so hard to be honest with ourselves, let alone those around us, about those dark thoughts. Kids have already, they've seen it on TikTok, they've Googled it, and they already know your condition, and they've been wondering why you've been trying to keep this a secret when it's so obvious. So I think in an age-appropriate way, you find ways to have an honest discussion about it in the context of, yes, there's illness, but we're getting treatment, and we are going to be okay. And I also try to give, like, young kids, they feel good if they have a role in taking care of mom or dad, right? So, hey, listen, when you come back, would you help me, you know, help me make dinner, or to be helpful in these ways? So that combats this feeling of loss of control, right? So those little things, but I would start with the truth in a kind, supportive way is the best way forward. It's never good to try to tamp down on what we hope nobody knows about.
Any other questions? I think you covered it. Thank you so much.
All right, thank you.